Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector Webinar Series for Caregivers. Today's topic is Caregiving-Prepare to Care by Dr. Carol Botts, sponsored by Prince George's County Government and Department of Family Services.
We're going to talk today about prepare to care, creating a plan. And in particular, we're going to talk about caregivers who are family caregivers. Caring for a family member or close friend is one of the most important roles you'll ever play. And for many of us, it is a role that we are least prepared for. I said we were going to speak about family caregiving, and those are very specific caregivers. These are people, like many of you, who care for an aging parent, relative, or loved one or friends, and that you do that caring without receiving pay. It also means that you are one of 44 million family caregivers in the United States, and in the state of Maryland, your uncompensated care accounts for about $12.5 billion. So you provide a very, very important service. No matter where you are in the journey of family caregiving, if you're just beginning to anticipate a need or taking care of a family member full time, having a good framework to help guide both you and your loved one will make the process easier. I hope to be able to give you suggestions about what that framework should look like. I do have to read a disclaimer. This session is intended to be informational and educational and does not constitute medical advice, diagnosis, or treatment. You should always seek the advice of a physician or other qualified healthcare provider for diagnosis and treatment of your specific medical needs, for questions regarding personal health or medical conditions, and before beginning or changing any treatment, activity, program, or dietary plan. AARP is not responsible for the consequences of any decisions or actions taken in reliance upon or as a result of the information provided during this event. Information for this presentation comes from the AARP booklet, Prepare to Care, and the AARP Caregiving Resource Center. So let's start by reviewing some facts about caregiving. The average family caregiver is a 49-year-old woman who works 30 hours a week and provides almost 25 hours of care per week. 75% of people who identify themselves as caregivers are women. Men are identifying more as caregivers, but the hours are different. 24% of Americans aged 18 to 34 say they are family caregivers. And the average recipient is a 70-year-old male. What this list does not include is actually another category of family caregivers called youth caregivers. And this is a hidden and vulnerable population of youth, that is children under the age of 18, who provide major caregiving responsibilities without any formal recognition and without any support from governmental agencies, educators, or the health community. The pediatric community, healthcare community in particular, is starting to be more attentive to this category of caregiver and trying to be better about supporting and advocating for them. These are caregivers that are still of school age. Many of these children are missing school and also missing out on a real childhood. I'm also struck by bullet number 4, where 24% of Americans aged 18 to 34 say they are family caregivers. For those of you with children, you appreciate that this age group, these caregivers are barely adults themselves. They're just figuring out life. And it's really kind of startling that 24% of them are actually responsible for other people rather than themselves. So with that in mind, in this session, we'll talk about why we need a care plan, the 5 steps to create a plan, quality of life while caregiving, what resources are available to you, and I will leave time at the end to take questions about what you've heard today. When we're caregiving, we may start off with a few hours a week, grocery shopping, picking up prescriptions, something small. That's usually manageable. But as time progresses, we'll find that those requests will expand and those added responsibilities may not be possible for you. So it's important to have a plan. And here are some suggestions about how to create a plan. Start the conversation, form your team, make a plan, find support, and care for yourself. I will mention that the first three sound intuitive to most people, and many of us may be inclined to forget the fourth and the fifth category, find support and care for yourself. I would like to suggest that all five of these situations are equally important. Think of them as five legs of a stool. Each of them is important. If any one of them is missing, then the stool does not support itself. So let's get started. Start the conversation. Very, very difficult indeed. It really is important to begin conversations about care as we age as early as possible. It really is not too early to start, in your 50s or 60s at least. And in a perfect world, you're not having the conversation when there is an acute need, there's an emergency, the person that you're providing care for is sick. That really is less than optimal, but unfortunately that is the case in many circumstances. These conversations might start with, where do you wish to have your health care? Where do you wish to live? Who do you want to manage your finances? These are difficult conversations. Often families avoid discussions about the future simply because they don't want to think about changes in the lives of the people they love most. Many people will wait until a crisis occurs before they talk about their values and preferences, their wishes for health care. So just start to think about what kinds of conversation you're going to want to have. A lot of uncertainty can be avoided if you talk with your loved one before a crisis occurs. These will be difficult conversations, and I want you to pay particular attention to the positioning of the people in this particular slide. They are side by side, not face to face. Face to face sometimes can be confrontational, and if you're going to have a difficult conversation, you really don't want to start off at being conversational. Sometimes it's helpful just to be doing something else. You'll see the couple on the right are making cookies or something. So it's some other activity, and so it's less confrontational. Here are some tips to start the conversation. But before you start the conversation, I think it's important to decide who is best suited to have that conversation. So some of us have communication skills that are favorable. Many of us, some of us, don't have skills that we necessarily are particularly proud of. And so if you're going to have a potentially contentious conversation, it's important to find someone who is good at communicating, who's empathic, who has a favorable relationship with the person that you're going to provide care for. All of this will set you up to have a productive conversation. You start by looking for an opening. What do I mean by that? You don't want to ambush anyone into talking about topics that can be contentious or private. Timing and context are critically important. If you know that this person is a morning person, wait until a morning on a weekend when you're feeling well, a person is well rested, is well fed. You really just want to make sure they're in the best shape possible. And then context is always important. You don't want to ambush someone. You don't want to, out of the blue, start talking about bank accounts and finances and last will and testament. That puts people on edge and makes them a little suspicious. You might even start the conversation by asking for their advice. For instance, I will be 65 soon. I'm thinking of signing up for Medicare and supplemental. What kind of insurance do you have? Do you like the doctor you're going to? These are just sort of gentle conversations. Take the opportunity, if you've been to a wedding or there's been a death or a new birth. These are times when people start to think about how they want things to occur for them. Respect your loved one's wishes. This topic will come up again and again throughout the talk. And I think it's important for us to remember that the focus needs to be on the care recipient, not on you. Try not to anticipate what your loved one might say or how they will react. Just get the conversation started and be open. Listen without judgment. Be quick to listen, slow to speak. You are not looking to make any big decisions on those opening conversations, but you're looking to get perspective about what this person wants. There may be things that they say or they hope for, which you know are completely unrealistic. That's perfectly fine. You're not making any proclamations or promises. You're just there to listen. Again, number 3, listen carefully. Understand your loved one's priorities. And so again, just to review, start the conversation. This conversation might be about bank accounts, investments, insurance coverage, other finances, assets, or income. Again, these are just examples. You need not have these conversations involve this. And they're going to be high-level conversations. Which banks do you use? Not how much do you have in your bank. Do you have a brokerage account? Not how much is it, who is your accountant, at least not in the beginning. Do you have arrangements? What is your supplemental insurance if you have it? Do you have long-term care insurance? Other finances, assets, or incomes. It's also important, I would say, to understand how people manage their affairs. And so we are long past the point where everyone gets a bank statement or a bill in the mail. You write a check and put a stamp on an envelope. Many of us have gone to paying bills by phone, paying them online. They are password protected. And so going forward with older adults as you're a caregiver, you may need to pry a little bit into how they are managing. And if they've got passwords, how are they keeping their passwords? Again, this might be a subsequent conversation. You really have to appreciate that this is the beginning of many, many conversations. Now, no surprise to anyone, but these are difficult conversations, and you need to be prepared to counter resistance. You may find that your loved one's initial response to your attempt to start the conversation is something like, I just don't want to talk about it. Some people are private by nature, and it's sometimes difficult for people to admit that they need help. I like to reframe the needing help for, I would like to help you coordinate and collaborate better for certain services. That sounds better than I want to help you, I want to do for you. I do care for my 93-year-old mother who lives alone in New York. I have 2 younger sisters who are in New York, and so we're sort of tag teaming, caring for her. She's been living by herself pretty successfully since 2019 when my dad died. And several months after his death, once things had settled down, we suggested that she might do better in the house, which is not particularly large, but there is a first floor bedroom. We suggested that perhaps she might move to that room. It's near a bathroom, it's a smaller space, it's on the first floor, near the front door. You know, we made a pitch for her moving. We got immediate hands on hip attitude, jaw tight. No way, no how, not going to do it. You can't tell me what to do. We backed off, not a problem. Several months later, we had a conversation to which she proudly announced that she had decided that it was much better for her to be on the first floor and that she had moved her things downstairs. We congratulated her on making that wonderful conversation. We sort of snickered to each other, but we have started to call her, you know, Mom, we call it leads with no. And so going forward, whenever we are thinking about some change we want to make, we just plant the idea, ask her to think about it, and then revisit it many times. It's turned out to be a much easier task than being confrontational. So once you have assessed the needs, you've made some priorities based on what the needs are, and you have a willingness of the person you're going to care for to accept some sort of support, it's time to form your team. Caring for a family member or a friend can be too big of a job for one person. Trying to do everything yourself may lead to burnout and problems with your own health and well-being. There is no need for you to be a martyr. It's important to form a larger network of family and friends, and importantly, to tap into community resources to share the load. Community resources, unfortunately, in some instances, are underutilized and poorly understood, but if you take away nothing from this presentation, I would strongly encourage you to think about the rich resources that are available for aging population. So here are some things to consider as you form your team. Look for members who live nearby. Proximity has its advantages. People who live nearby are in much better position to stop by, to check in on a family member, to run small errands, but don't assume that because they live nearby, they are necessarily available to do the things you need to do. Or if you don't live nearby, that you're not available. So just because someone doesn't live nearby or have huge blocks of free time doesn't mean they can't pitch in some way. Think about people that can help with simple tasks. I mean, things that are one time, that don't take a lot of time, don't require a long-term commitment. Older adults that have pets may need the pet walked, snow shoveled, lawn mowed. These are simple tasks. They are well defined. A word about asking people to do simple tasks. It's important to be very specific about the task that you're asking. For those of us who have raised children, you have had the conversation about go and clean your room, and they come back to report they're done. You go in to check, and it's difficult to tell what they've done for the past year, the past hour that they've been in that room. Everything looks pretty much the same, with the exception of perhaps a clear path has been created from the door of the room to the bed, which is improvement, but was not what you were hoping for. For example, if there's a pet that needs to be walked, how many times a day? Where do you take the dog for the walk, or the cat, or not cat, but where do you take the dog for a walk? How often does the dog need to be walked? And so that if you assign someone to walk a pet, that person is very knowledgeable about what the task entails, and you will be more likely to have success with that task. Look for people who will share their talents. Not everyone has the same talents. Try not to ask people to do things that they're not particularly good at. Do not ask the person that's the worst cook in the group to bring covered meals. Do not ask the person who refuses to do anything digitally to do a Zoom meeting. So really assess where people's talents are and leverage the talents and strengths of your team. So next, it's important to build and support your team. Determine the number of team members. Do not assume that more is better. Depending on the task at hand, sometimes more is not better, and people get in the way, or they get bored, or they get discouraged. So determine the precise number of team members. It's probably easier to start with a fewer number and then build, rather than to start with too many and have people get a little frustrated. Assign roles and responsibility. Everyone has something to contribute. Play to each person's strength and be clear about what's needed and expected. Do not expect things to be fair. Fair is a feeling, not a fact. People will do the things that they can do best. And again, here's the focus. Focus on the care recipient. Again, this is a recurring theme. Be mindful of what their wishes are. Unless there are extraordinary circumstances, mental or physical incapacities, the care recipient should always be the focus. Remember the sensitivity of the information that needs to be shared, and be mindful that the care recipient may not want to share that information with everyone. Remember that there may be interpersonal dynamics that you may not be aware of that makes the care recipient not to deal with certain people. So you really need to check in with that person to make sure the plan and the people that you have involved. Be mindful of the fact that if they're living alone in a community, you want to be careful about who in the neighborhood is aware that there's an older adult living alone in the neighborhood. This may create some safety hazards or scam potentials for the older person. So now it's time to make a plan. Here are some suggestions about making a plan. A family meeting is one way to help you get things organized and ensure that all of your team members are on the same page when it comes to making and keeping the plan. So start by meeting with your caregiving team. These days, that meeting can occur any number of ways. Certainly in person if that's possible. It can occur virtually through all manner of digital platforms. It can occur by email or text. Whatever meets the needs of that particular team and can involve as many people as possible. Next, assess the goals and the needs of your caregiving plan. This is where I pause and make a shameless plug for a document called the Prepare to Care Guide. It is a publication that is available free of charge through AARP, and it's a workbook with helpful checklists and resources and glossary, and really is a very valuable way to start to make a plan and organize that plan. After you determine your goals, delegate responsibilities. It's time to figure out who will do what. Make sure you determine what tasks everyone is comfortable performing. Also, be sure to ask your team members about their preferences. When you're having the team member, include the person who will receive the care. Again, over and over, it's important to remember who you are making the plan for. Keep everyone informed of the plan. You will need to constantly remind people what they have agreed to and be willing to make changes if their availability to satisfy that responsibility changes at all. Taking notes is an important way to make sure you keep on track. So the fourth leg of that five-legged stool is to find support. If you've come to realize that the scope of care needed for your loved one is beyond what you or your team can provide, it's okay to reach out for extra support. And there are a number of ways you can obtain the help you need. We've divided them into two resources: community resources and professional help. Locate your community resources. Again, I can't say this loud enough. Your local agency on aging can help connect you to a variety of support services: home care services, housekeeping, meal preparation, laundry, shopping, transportation, adult daycare. The resources are very rich. Your local agency on aging also can answer questions about which resources are free and which may have a cost. There is something called an elder care locator. This is a public service of the United States Administration on Aging. It connects caregivers to local services and supports. Next, consider consulting professional help. Often, your care recipient's needs are complex, especially when health, emotional, and financial issues are at play. A trained social worker or nurse can help you sort things out, determine what is needed, find services, and arrange care. You may need counseling, mental health counseling, occupational therapy, physical therapy. And do not forget to also ask your employer if they offer an employee assistance program, if that is applicable. They can also connect you to professionals and other services in your community. Here are addition support ideas. Hire help. Again, mowing the lawn, shoveling the snow, light housekeeping are all things that you might consider. Again, there's usually a fee for these things, but give them some consideration if you can. Secure their safety. What does that mean by secure their safety? It's important to look at potential fall hazards in the home. Are there throw rugs that are not taped down? Are there step stools in the kitchen so the care recipient is not climbing on stools and that sort of thing? Are there lights on stairways? Are there banisters on stairways? Are there grab bars in the bathroom? Are there lights from the bed to the bathroom so that they're able to safely get up and go to the bathroom at night? Again, there is a document called the Home Fit Guide, a publication of AARP, again, available free through AARP. And this guide examines what makes a home aging friendly. It's 30 pages of suggestions and the kinds of designs and modifications that can make a home safer, more comfortable, and a better fit for residents as they age. Explore housing options. So this is a really big one. As the population ages, as of 2030, estimates are that 25% of the population will be over the age of 65. And by 2034, that people over the age of 65 will outnumber people under the age of 18, which is the first time this is ever happening. We know that the housing market is not sufficient to accommodate this rapidly aging population. And so exploring housing options becomes very important. There are also many, many options that were not available 20 or 30 years ago, and particularly with people that are in their 80s and 90s now. For them, the options would be living with a family member, staying in their own home, or going to a nursing home. There are any number of alternatives to those three now. The Prepare to Care guide also has a wonderful glossary that helps you understand what's the difference between assisted living, continuing care, retirement center, a senior living community. So the options for how we age have changed tremendously, and understanding what those options are going to be real important. Most people probably, if they can, would prefer to stay in their own home where they're comfortable, in a community where they're familiar. And before we start to jump to housing options with the care recipient, it might be important to understand from their perspective whether they would like their home to be part of their legacy. And so if you're talking about leaving your home or going to an assisted living, you will necessarily need to sell your home. If the person you're caring for has decided that that home needs to stay intact because it's part of their legacy, they want to will it to someone, that will change what those conversations will be. It may be making some modifications in the home. It may be a stair lift if there isn't a first floor bedroom. But it's important to understand what that person has in mind for their home. And sometimes that's what they mean by, I just want to stay in my own home, which is different from, I want to age in place. Has completely different meanings. So looking at housing options is going to be very important. And then the last leg is to care for yourself. Again, the one that we think about the least. I like to reframe this as invest in yourself. Your continued health is going to be important if you expect to be able to provide care for someone. This is important not just as fluff on the side, but the statistics around caregivers is pretty dismal. Caregivers show higher levels of depression. They are in worse general health. They suffer from high levels of stress and frustration, and they have an increased risk of heart disease. So not only do these issues affect the caregiver's quality of life, but obviously they will impinge on the caregiver's ability to care for their loved ones. So as you start to care for yourself and as you find things that are working for yourself, don't hesitate to share what has worked for you to care for yourself with others. For instance, offset stress and frustration by tapping into resources. Use social workers, nurses, and other professionals. These professionals can guide you through care choices and help monitor care when you don't live nearby. Use technology, personal emergency response systems, a medical alert device, a remote monitoring devices, and mobile apps can help you coordinate care when you're not there. Make sure to review your finances. It's important to calculate your caregiving related expenses. We've already calculated them to be $12.5 billion for the state. To offset your general poor health, begin by talking to your doctor. Let them know that you are a caregiver and discuss ways to manage stress. You should also consult with your loved one's doctor for training if you're expected to do complex medical tasks. Take a break. Make time for exercise, sleep, healthy eating, and staying connected with friends. We'll talk a little bit about quality of life issues because people who are vulnerable, which this population is, are more susceptible to these challenges. Issues caused by the coronavirus pandemic, isolation, loneliness, distancing, and quarantine. Fortunately, we are in year 3.5, and some of this is not as much of an issue as it might have been. But I think it would be unrealistic to think that we have not all been affected in some way by the past 3 years of really having our whole world turned upside down. Also remember that as we age, anxiety and depression are necessarily behavioral health conditions that become much more prevalent in this population. Personal protective equipment. Again, we have been wearing masks. It's been hard to see and hear people, which can be very disorienting for an aging population. Many of us are starting to put back on the mask because the coronavirus is starting to raise its ugly head again. And so this all impacts people who are vulnerable. Difficulty with technology. This is a big one. You know, in March of 2020, our world went from high touch to low touch. We went immediately to an assumption that everyone knew how to use technology. Prior to March of 2020, I thought Zoom was my favorite Commodore's song. I had no idea what the Zoom platform is. And so we all had to learn very quickly how to manage technology, if for no reason than to be able to stay in touch with loved ones. We all had virtual birthday parties and holiday celebrations. So keep these all in mind. This slide just gives you a sense of the rich resources that are available through AARP's Caregiving Resource Center. It is the central hub for all things caregiving. You can read the latest articles, tips, and advice. And that's where you'll also find the Prepare to Care guide that can be downloaded, or you can request a hard copy. AARP Learn at 50 Plus is also a site where you can listen to webinars, you can learn about caregiver burnout, professional care options. So again, very, very rich resources. That concludes my talk for today. I'd like to thank you all for your kind attention.